Hi, friends, and welcome back. So, before we begin, I'd like you to answer this for yourself. Does your body still brace when nothing is wrong? When you wake up, do you feel a heaviness in your hips or tightness in your belly, or maybe just a low level anxiety that follows you through the day, even when life looks fine? If the answer is yes, you are not broken and you're not behind, but your body is likely holding on to a story that it just never got to finish. And most of that story, in my experience, lives in the psoas, which is one of the deepest emotionally related and guarded muscles in the human body. Today, I'm going to show you 3 simple psoas release exercises that you can do right at your desk, plus one powerful bonus stretch at the end that you can do laying down that helps this unlock this emotional tension that you probably didn't even know you were holding. So let's take a deep breath and begin. Hi, I'm Amy Rose White. I'm an integrative psychotherapist making YouTube videos on psychospiritual self-healing tools. So if you're here, again, you might be experiencing one or all of these pain points. Chronic hypervigilance. You move through the day with this subtle sense of holding on or guarding. When our nervous system is on guard, it's like even when we're safe, there's tension. Pain point 2, emotional bottlenecking. So that's when we feel like we should be able to relax, but our body stays tense, buzzing, kind of frenetic or heavy, like as if it's holding on to something that we can't quite access. Pain point 3, unexplained hip, belly, or low back tightness or pain, no matter how much you stretch, foam roll, or meditate. There's this deep tension that just doesn't want to release. These are classic signs of a contracted psoas, and when we release it gently, the emotional and somatic shift can be profound. So let's understand sort of the psychospiritual nature of the psoas. I truly look at it that way. And you can see the psoas here in this diagram next to me. Because the psoas is more than a muscle, it is an inherent part of our fear response, our posture, how we breathe, and our sense of safety in the world. It connects our diaphragm to our spine to our hips, kind of acting like a bridge between intuition and action, survival and presence, and past patterning and present truth. When the psoas that connects all the way through here, from here all the way through the gut, when it's tight, our body behaves like life is dangerous. And when it softens and releases, our entire nervous system remembers ease, clarity, and emotional spaciousness, which is my personal goal. So let's begin with the first exercise. Number 1, this is called the seated psoas melt. So it's kind of a somatic softening practice. We sit comfortably with both feet grounded. We place one hand on our belly and one hand on our heart, and shift your weight forward slightly so your sit bones are rooted down. And let your belly hang and soften, really soften. Especially women, we don't often let that happen. Act as if the body is finally allowed to stop holding itself together. Inhale gently. Exhale and imagine that muscle, the psoas, melting downward along the spine like warm wax, softening into gravity. Again, inhale, presence. Exhale, melting, unclenching, releasing. This is where the emotional thawing begins. So we just stay here for a few breaths. Let the body decide what it's ready to release. And when you feel complete, return to center. We're not trying to force anything here. We're just noticing if we can use that visualization to bring softening and letting go to that deep muscle underneath our hands. Number 2 is the desk side hip release. This is a rhythmic opening and closing motion that helps to unwind this survival tension that the psoas is engaged in. One of the reasons that it can be tight across a lifetime, particularly if we grew up in chronic stress or trauma, is that it contracts in protective posture. And our body naturally actually collapses and contracts in the face of danger or perceived danger, whether that's emotional, physical, sexual, whatever. If you perceive it, your body believes it. So that contraction, and then we often sit at a desk all day and we're hunched over our computers or our phones, that contraction leads to that shortening and tightening of that muscle. So anytime that we're making conscious contact with it, and we are using our other limbs to stretch it, it gets a chance to feel the energy of release and safety. So how we do this, we move toward the edge of our chair and start by lifting one of your knees an inch or two, and then gently rotate that leg outward and open, like we're opening a small door at the hip. It can be a few inches, it can be several. Just hold it open softly and breathe into the side of your belly that that leg is on. On the exhale, let that leg come back to center without controlling it. And do it again, open, breathe, exhale, return. So just keep going open and close and let that movement be organic, not forced. This rhythm tells the nervous system, I can open and close without threat. My boundaries are pliable by choice. I can soften without losing myself, things like that. And then just switch sides when you're ready and do the same thing on the other side. And you'll notice that one is tighter than the other. I'm noticing that right now. And just see if you can make that mind muscle connection. I'm safe, I'm here, I've got you. And just notice that gentle opening and closing. And we're doing this slowly, we're not doing it fast. Exercise number 3 is the seated diaphragmatic drop. So this release kind of helps, again, unhook that stored emotional pattern of contraction. So we place our fingertips softly beneath our rib cage. Inhale, let the ribs expand into our fingers. Exhale, and then let the diaphragm that sits below here drop downward. Feeling your kind of stomach drop as if the floor of the chest is melting into the pelvis. This invites that psoas to lengthen without stretching or pushing. So again, we inhale, gentle widening. Exhale, drop, soften, and surrender. So this is where the deeper emotional layers often shift. Just let them and stay there for a few breaths. And again, if emotions come up, I know these movements are really small and really subtle. And, from a physical therapy or maybe craniopsychotherapy standpoint, we're not going deep yet because we're sitting. But believe me, they can be extremely powerful. And you might even find yourself shaking, trembling, crying with any of them. And the idea is to just invite awareness and allow that dropping. Then as a bonus exercise, edge of the bed psoas drops. So you're going to see a little demonstration here in this video here. So we let gravity help us to release that psoas for even deeper emotional unwinding. And we do this by lying on our back near the edge of one side of the bed. Hug both knees into your chest for a moment. So we're kind of in that conscious contraction. Then gently lower one knee down, so your foot's on the bed, and lower the leg off the side of the bed, letting that leg hang freely towards the floor. So no pulling or pushing, we're just letting gravity assist. This passive relief speaks really directly to the subconscious pattern that's in that holding and contraction, which is you don't have to hold everything up anymore. And just hang out there for a minute or two and then switch legs when you're ready, giving each side some time to unravel. So if you've done that with me, place one hand on your heart and one hand on your belly and feel what has shifted. Notice if there's any more spaciousness. Feel the returning. Our psoas is the place in our body that remembers our past, and it's the place where our soul can re-enter the present. And if you've joined me, you did powerful somatic work today. And I'll see you in the next one. Bye for now.